Hey, Lindy, welcome to the show.
Hi, thanks for having me, Brent.
No, anytime. I was super happy to have you on. Very excited. I've been following you for a bit on Twitter. For those who don't know who you are, though, could you maybe give us a brief introduction of your background, qualifications, that sort of thing?
Sure. My name is Lindy, and I'm a healthcare provider. I am a physical therapist, and I was trained at Northwestern University in Chicago, where I got my doctorate. And I've worked in all sorts of settings over the past decade, hospitals, in and around California. I had my own clinic where I treated people in Southern California. And then now I primarily see people in their homes, usually folks that are over 50, all the way up to, sometimes past 100.
Hmm.
And I help rehab them with any problems that they have. Lots of, falls and fractures or just general weakness. And then my biggest thing lately is I help people after like elective joint replacements, like knee replacements, hip replacements. So I'm there to help them get strong. And I also like to talk about how nutrition plays a role in rehabbing their body. So that's what I do most days, and then things like this on the side.
Got it. Got it. So I've got a couple of questions. So I know
Hmm.
that there are different types of physical therapists, right? So you got your
Hmm.
PT and then you have DPT, which you are, right? The doctor of physical therapy.
Yeah.
Can you maybe explain the differences in like schooling and requirements that goes into each of those tracks?
Sure. I mean, there's actually only one track now. About 25 years ago, like if you wanted to be a PT, you just had to get your doctorate. So
Hmm.
unless you're, of a certain age, like everybody has their doctorate, it's just what you do. So you have to, have a pre-med background just like anybody else who wants to be an optometrist, dentist, physician, what have you. And then you have, 3 to 4 years of full-time schooling. So you come out with your clinical doctorate and then you can choose, much like a physician, any path you want to do or to specialize in. And that's it.
Got it. So I think I understand. So you're a clinical doctor, and I get
Correct.
the fact that you're helping people with rehab and that sort of thing, but you can't like prescribe medications or anything, right? That's like a
Correct. That is
okay.
not within our scope of practice. I mean, there's talk of it, but, I don't even know if it's necessary. Like other members of the healthcare team could do that. Um, but we'll see where the profession goes.
Got it. And sorry, I'm just completely ignorant about this. I
No,
have a
it's
lot of
okay.
optometrists in my family, so I'm sort of up on the pre med component of this, but beyond that, in
Sure.
specialization, I sort of get lost. Um,
Sure.
so how much? This maybe you can pull the curtain back a little bit on medical training. How much
Mhm.
nutrition training does a typical pre med student or even like an MD receive?
Yeah, I think the statistic right now is about 17 hours.
17
And
hours.
I know, right, right. Out of 4 years of training, right? And my experience that, nothing against Northwestern, I think it was a fantastic program, but they definitely have some room for growth in terms of nutrition education, especially for a program like mine, where our job is to build muscle and sometimes restore or rehab like the nervous system. So nutrition is so key. We spent about a half a day, one day in school, half a day.
Wow.
So that was the extent of mine. And the gist of it was basically like if you encounter a patient that needs some sort of nutrition advice, which is every single patient, um, have the physician call the physician and have them refer to a dietitian. And you and I both know that that could end good or bad, right? They could have a dietitian that tells them to eat the standard American diet and, just cover everything up with insulin if they're diabetic. Or you could, find a diamond in the rough, someone who's a little bit more of a rogue dietitian and up to date on more of like what a proper human diet is. But for the most part, it's, drink and sure, eat the standard American
Oh,
diet, 8 to 11 servings of bread a day,
oh God.
right? So that was the gist of it for my education. So everything that I've learned has just been, in my own free time, past decade. And I knew a lot going in just because I was super passionate about nutrition since I was, 17 years old. So, um, but not everybody is. So there is a problem then when speaking to patients about like how to properly fuel their body.
Got it. And I have a question, and I'm not sure
Hmm.
if you know this or not.
Yeah.
It comes from my understanding of the medical field is typically doctors have what's called standard of care, right? So you
Mhm.
have this, for people who don't know, this is sort of the established guidelines, and it's sort of forced
Right.
onto a lot of medical professionals. And if you deviate from the standard of care, you can, sometimes have your medical license revoked or some other form of censure, right? I'm wondering
Totally.
if registered dietitians have a similar thing. I'm very keenly aware of how the United States healthcare system works and how all there's vested interest, right? Whether it be agriculture or who knows, right? There's a bunch of different moneyed interests that are sort of pushing these guidelines. You even look at the row around the American Diabetic Association. Is that the ADA?
Mhm.
Around some of
Yes.
their guidelines, they're offering these crazy things that are clearly unhealthy. And so my question is, like, do you see that in the dietitian world? You said, hey, you might have a rogue dietitian that might give you some good advice. Um, so my hunch or my hypothesis here is that, like, it's a similar thing. There's like a standard of care, quote unquote, for dietitians, or at least sort of like an indoctrination or education track that tells them all essentially the same thing to get them certified. Do you have any insight into that?
Totally. I mean, I've talked with many dietitians about this. One rogue one, Temple Stewart, maybe you follow her on Twitter, or maybe some of your listeners do. She, went the traditional path, for example, and was indoctrinated with all of the things that, you learn in dietetic school. I can't speak to that, but, it was basically following the standard American diet. And then she worked at the VA in this country, and I believe she got introduced to Virta Health, which does things a little bit different.
Mm-hmm.
And so anyway, she was working at the VA. She learned about Virta Health and like a low carb diet to help folks with diabetes, right? Which was a big chunk of her patient population at the VA. And she ended up following the Virta Health advice, and she was getting patients off insulin, like dozens of
Mm-hmm.
VA members, which was incredible. And she got a lot of pushback from her supervisors in the hospital. So to answer your question, I do think there is like this, standard of care. And if you don't follow it, you're going to hear about it from your supervisor. Like, hey, watch out. Like, this is how we do things at the VA, or this is how we do things at the hospital. And I think that would be very challenging. And for Temple, how her story ended, she was just like, well, I can't do this anymore. So she went out on her own and now helps thousands of people. She's got huge account, but unfortunately now those folks at the VA don't have someone like Temple in there,
Right.
actually helping them reverse their type 2 diabetes or put it in remission, or have a healthy A1C, like normal blood sugar. So I do think there is that. And then also I've talked with other dietitians who work at big hospitals, and hospitals have huge contracts. They make money by contracting with, like a company like Abbott that makes Ensure,
Yep.
right?
Yep.
So when they give it out, like the hospital makes money. So if you have, let's say, a dietitian, promoting real food instead of that, well, that affects the bottom line of the hospital. And you're definitely going to hear about it from your administrators.
Yeah, that's gross. And it's so hard for people to understand what's true anymore. And I think there's so much misinformation out there. I hate to use that term. It's a weird term. But you know what I'm saying? There's so much,
Yeah.
maybe confusion's the right word. Like, people have a difficult time understanding what's true and what's not.
Mhm.
And so this actually makes me think of something. Going back to the topic of medical training around nutrition, it reminds
Mhm.
me of a clip. Not sure if you've seen this, but Dr. Paul Saladino was on The View, and they just excoriated him, like,
Oh, yeah.
because he was an optometrist, I think, or ophthalmologist. Can't remember what his specialty is. And
I think he was a psychiatrist,
oh,
I
was he a
believe.
psychiatrist? Okay,
Yeah, like he like full out MD in psychiatry, which is, any physician can talk about nutrition. They should.
right, but they were so hyper focused on that sort of aspect of it, like, oh,
Totally.
you're not a specialist in this thing, and it's like, well, you're a medical doctor plus a different specialty. And he raised something that's really important and something that's been helpful for me, trying to suss out what's true and what's not with respect to claims about nutrition, which is like, hey, can you read a study, right? And this is probably wonky for a lot of people. No one wants to get this deep, but half the time, probably way more than half the time, people read a headline that says study shows blah, right? And they
Mhm.
don't even probably read the article, let alone pull up the abstract, and probably even fewer are actually looking at the study itself, and even understanding the different types of studies and strength of evidence and cohort size and confounding variables and all these things. Like I think that there's so much that people could do on their own if they just picked up a couple of just basic things, right? I don't think you have to understand how regressions work and deep into the statistics. But I think that people could go a long ways to helping themselves by just understanding what a particular study might indicate and what it might not. So, do you have any thoughts on some things that people could learn, like at a base level, that could help them sift through some of this data?
Yeah. I mean, it depends on what you're seeking from these studies, because unfortunately a lot of nutrition studies are based on their epidemiological studies. So
Mm-hmm.
what that means is it's not really a science experiment. It is an epidemiologist handing out a person a food study questionnaire with things like, how many cups of meat did you eat last week? And I'm like, I don't even know what I had for breakfast yesterday.
Yep.
I don't know how many cups of beef I had last week, or questions like that. And also, it doesn't like it's like multiple choice. So like, what if you didn't have any beef, right? So the study design, if we even want to call it a study, is terrible and abysmal. And, it is hard to do a nutrition study. You're not going to lock people in a metabolic ward. I mean, you can,
Mm-hmm.
but it's super expensive. No one wants to give up their life to go into one of these metabolic wards for, months at a time. So what I like to tell people is honestly, forget all of that, right? Go back to the basics. Eat simple, real, whole foods. Okay. Most of your problems are going to go away if you do that, right? If you stay away from Pringles and Fruity Pebbles and all these things that are marketed as healthy to us, and really just eat things that are from the ground or animals, you're going to be okay. That is my take on it. I don't know if it's the right take, but it's how I've lived my life. And when I see patients adopt this principle, they get better. So I don't even think we have to get that complicated. I think just eat real whole foods, limit your carbohydrates if you can. You can still eat them, but don't overdo it. But if you're eating the right amount of animal protein, you're going to stop eating when you're full anyway.
Yeah, I think you're right. I think the this whole thing of hyper focusing on perfection, and it's like, what's that whole the old phrase, like, don't let the perfect be the enemy of the good.
Mm-hmm.
I think people get paralysis analysis oftentimes, and they will just, I don't know what to do. And it's like, yeah, I think if you just start, like you said, with just eating whole foods, I think you're going to be much better off. And I think people can also treat themselves as an N of one, and like, hey, what works for me? Because the human human beings are so biodiverse. Like there's so many things that go into how we react to different types of foods. That's where I think people get mistaken when they start getting into these little tribes. Like, oh, I'm carnivore, I'm paleo, I'm vegan, I'm this, that. Like I think that is really wrong. I think people need to start focusing on what works for them. The only way to find that out is to do that N of one and tweak a couple of dials here and there and see how you feel. Look at your blood work, find out important markers, understand what they mean. Track them year over year and see what works for you. I think that's the best way to go. Like, that's my lay opinion.
Yeah, absolutely. And when I'm talking with someone who's like totally lost and doesn't know where to start, I'm like, okay, homework assignment one. And I do this with most of my patients if they bring up nutrition, because it is a sensitive topic and people get super emotional about it. Is I want you to take out an old fashioned piece of paper and write down the proteins that you enjoy, right? Your list is going to look different than mine, and that is okay, right? So I usually give an example. I'm like, I have ground beef on there. I have feta. I have, ribeye. I have salmon. I have sardines. I have oysters. I don't have cottage cheese because I don't like that. But if you have the cottage cheese, that's okay,
Mm-hmm.
right? So I think step one is just like identifying what real foods you enjoy. And then two is have like a little food journal, right? Like, sure, you enjoy some of these foods, but then write down how you feel that day or the next day, right? Maybe you're really sleepy after you have some certain meal, or maybe you feel like sad the next day after you have something. Like listen to your body, that whole N of one thing, right?
Mm-hmm.
Just because it works for you and I, Brent, doesn't mean it's going to work for somebody else. And like that is where the key thing is like finding out what works for you and then honoring that and sticking with it.
Yeah, I completely agree. And I don't know what it is, but I've seen so many people trying to police other people's food choices online. It's almost cultish, and it's kind of creepy. It's because I'm just like, because I started with the carnivore thing, right? Like I started in December. That's when I was like, I really have to make a change, and it really worked well for me. But then like I was, I had a plan. I was like, I'm going to do the January World Carnivore Month. Cool. See how I
Right.
feel. That was fun. And then the next month, I'm going to add a little bit of fermentable fibers like kimchi, sauerkraut. And then the third month, I'm going to add a little bit of fruit like blueberries. And it's weird. Like I got a little bit of hatred. It's like, what are you? It's like, no, it's
Right.
fruit and honey. Yeah, it's a little bit of fruit, a little bit of honey. And I have people coming out of the woodwork telling me like I'm, doing all this. It's terrible. I'm going to just get heading towards diabetes and saying all these crazy things. I'm like, wow. Like, number one, there's no evidence that indicates any such thing in the literature. And number two, I feel fantastic. And number three, it's like, well, how about you mind your own business? This whole
Totally.
this tribalism, this cultish behavior is very weird to see. And I wish people could just be more encouraging of other people and maybe curious about what works for somebody else and stay in your own lane.
Yeah. I get that a little bit too, like I'll post something like, maybe like a burger and then there's like avocado on it or like, God forbid, a tomato or a cucumber, and people get upset. Like, that looks great, but take away this. And it's like,
Right.
okay, well, I feel good with it. It's not like it's Cheetos on the side. Like,
Yeah, yeah.
calm down. Yeah, and I think that there are some great people, in this community as well. So,
Oh,
but
for
yeah, I,
sure,
I
for
agree
sure.
with you. I think that you can, if you want to eat vegan, great. I do recommend you eat real whole foods on a vegan diet. I hope you're not eating just like, lab junk food. Um, but like if people are eating real whole foods, whatever that looks like, if it's working for them, great. When it's not, that person will probably change or seek help if they need it.
Yep.
How did you feel after the carnivore month, and then how are you feeling now that you added these other foods?
I felt fantastic. And what was weird to me is that as soon as, like I said, in January carnivore, February I added the kimchi and stuff, and I thought
Nice.
I thought that I would want more of the other stuff, right? But it was very odd for me. It's like I still just wanted beef almost exclusively, and so I think I maybe
Interesting.
had like 2 to 5% extra stuff besides beef for February, and then March I would have. I think I've maybe had five things of whole blueberries like for the whole month. Like so I'm still very much sticking to the beef thing, and I don't know if it has to do with, I know that your gut microbiome changes when you eat foods, and you'll get like a feedback loop. So if you have, and by the way, correct me if I'm wrong, this is my understanding of it as a layperson, that your gut bacteria actually will adapt to what you eat and then start sending signals to your brain to want more of that thing.
Yeah.
And so I don't know if there's that at play, but essentially, my hunger has been pretty much put to bed. Like I'm not hungry hardly at all. I will eat
Wow.
like some sort of steak for breakfast or ground beef or maybe ground beef and eggs, something like that. I almost have to force myself to eat at dinner time because I'm trying to get to enough protein. I've been focusing
Sure.
on making sure I'm getting enough macros, and so it's been very easy for me, which is great because I have a very stressful job. I'm very busy, and also ADD like crazy, right? Like I have a very
Mm.
difficult. Like you're like, oh, get a food journal. Not going to happen. Not in a million billion years. So for me, having it be very, very just stupid simple really helped me along. I didn't have to think about what I was eating. A lot of people tell me I'm crazy, even in my family. They're just like, "Are you really just eating this stuff?" And I'm like, I feel great. I've lost almost 40 pounds.
That's
Like
amazing.
everything is like my brain fog is gone. Like all the symptoms I was having, just seem to be kind of gone away at this point. So, yeah, it's really working out for me. I don't think I'm going to stick to pure carnivore. I keep thinking I'm going to like keep expanding some stuff. I'm probably going to do more fish. Like I've been going to Costco lately. They've got this great deal on chuck. It's like $4.99 a pound at Costco. Really well marbled chuck. Which, by the way, I looked at your article. I think you had the how much protein reference guide. I didn't realize, but chuck roast is
Yeah.
actually 35 grams of protein for 4
I
ounces. That's
know.
like I didn't even.
It's like
I always got it because it was cheap and it was had a good ratio of fat to protein. It was almost like a ribeye, it felt like to me, but it was like
Totally.
super cheap. So it was just so easy to do. I can get a big thing and I can slice it 2 different ways and get like 4 steaks out of it. And so for me, it was just
Sure.
convenience. But I'm looking at this and it's actually better than ribeye and skirt, flank, sirloin. Like it's at the top. So,
And
um,
it's so easy to make too,
oh
right?
God,
Especially on like a cold day, you throw it in the oven, it comes out, and then you have like shredded beef for the week. It's great.
yeah, 100%. And or just like I'll leave for the day and throw like a roast in the crock pot, and I get home and it's ready, and I got a bunch of bone broth left over. It's like it's so simple. I
Yeah,
don't know why
it's
more
so
people don't do
versatile.
this. I think it's fear, right? Like I think a lot of people still have this boogeyman. Fat is bad. Red meat's going to kill you. I just hear all this stuff. And I don't know how to counter that. So maybe I should back up a little bit. So maybe I should ask you: do you think there's any validity to some claims about red meat being bad for your health?
I don't, but I could be wrong. I really like Sean Baker's approach. I'm sure a lot of your listeners are familiar with him. Like he's saying, my job is to him as a MD,
Mm-hmm.
his job is to help patients get better in the here and now, right? And when he prescribes like a real whole foods diet that is centered around red meat, he sees people get better. But he's like, I could be wrong, 20, 30 years down the road, maybe this is terrible for us. But he's like, my job right now is to help people right now. And I like that approach. I think that we don't know enough, but I do think we have to look at evolution, right? We
Mm-hmm.
evolved eating red meat. And people get upset about that, but it's true. They're like, oh, well, we didn't live, as long back then. And I'm like, I'm not convinced it's because we were dying of colon cancer or,
Yeah.
like heart attacks, out in the wilderness. We were probably getting infected. And now we have like antibiotics and we have, vaccines for things that used to kill off people, right? So I could be wrong, but I look around at folks like you and hear your story, look at myself, and I see health when people start to focus around red meat. So I'm not convinced it is the boogeyman, but it's a hard thing to convince others of that. I hear every single day when I ask a patient, just like an open-ended question, like, hey, what's your diet like? And the first thing they say, literally every single time, I don't eat a lot of red meat.
Mm,
It's kind of their way of saying I eat healthy, right?
got it.
And it's fascinating. And this is not like a low health literacy community I lived in. This was in like Southern California, Orange County, and San Diego. And now it's in like one of the most like I'm not affluent, but I'm a pauper in my community. But my patients are CEOs running big companies, like they're not stupid people. But they still are hearing this from their doctors, even their like Ivy League concierge doctors, avoid red meat, never eat egg yolks. So it's still very pervasive, even in highly educated circles. So it's a problem. And I'm here to address it.
Well, thank you for doing that because I think there are a lot of people that are just hungry for information. That you're just seeing that everywhere, and I think that there's a lot of skepticism around these grand narratives around nutrition. I think people are seeing the outcomes are not matching what they were told the outcomes were going to be, right? And so I'm glad that we're having these conversations. I hope this isn't too wonky, but there's two areas where I think that people are focusing on with respect to red meat being potentially
Mhm.
harmful. And I think it's around two things, and correct me if I'm wrong or add something if I'm missing it, which is stimulation of IGF-1 and mTOR. Right. So do you know anything about any of those two, mechanisms there?
No, I mean, like I listen to health podcasts every day and, hear people like Dr. Peter Attia speak to these things, but I'm by no means an expert in either of these things. So tell us what you know, Brent,
I don't
what
know
you're
a
hearing.
lot except for I see IGF-1 being called out as a boogeyman by a lot of anti-meat activists. So it's a lot of the vegan community. Like I'll see them posting trials like, oh, there was this, there's a claim because I think it was, what was it? It was Beyond Meat or somebody funded this study. It was a crossover trial and it had to do with, I think it was a 2-week crossover in each phase, and at the end of it, the people that were on the meat had raised levels of IGF-1, and it was minimal too. It was ridiculous. It was like 0.5% or something. I mean, it's just a negligible bump in IGF-1. And they said, oh, it's associated with this negative health outcomes because IGF-1 is correlated with, I don't know, insert whatever bad thing that I forget exactly what the that negative health outcome they claimed was, but I see them touting this as a reason to avoid red meat, and so that's like primarily where I'm seeing the IGF-1 stuff. But the other component is around mTOR. I've seen a lot of people talking about that's a mammalian target of rapamycin, and that's essentially a protein sensor, I believe. Maybe, I can't remember, leucine or something like that. Is like I said, I'm not an expert in this, but that's what I'm hearing. So sort of like your body's like a way of saying, hey, I'm receiving nutrients, and then there's like a cascade of things that happen in your body that increase aging purportedly, and a couple of other things, right? And so I've heard the claim with respect to mTOR that yes, you're going to feel better now, you're going to get more muscle mass, you're going to feel better, but it's going to be a shorter period of time, being alive, essentially. I think that's Dr. Peter Attia's claim. And so I just don't know what to make of it, right? Like these are things that I feel like it's in the bucket for me of like, I don't know, like maybe. I've heard Rhonda Patrick talk about IGF-1 as well, and I understand there are some concerns around it, but I haven't been able to suss out like the validity of these claims and if it's something to actually be worried about, or if there should be any, modification of anything nutrition wise with respect to these topics.
Sure. I mean, I think that if you're like super into biohacking, like maybe like pay more attention to these things. But again, I think like, what is the goal here? Like, and I think that that's why, like, I think that, Rhonda Patrick, Peter Tia, they're, Huberman, they're all like adding some really great things to, health and wellness space, but they often like hone in on these like very specific things. And I think that they, lose the forest through the trees, right? We can't see the forest through the trees. And, like, let's look at some other markers. What's this person's body weight? Do they have like excess abdominal fat, right? Like, what is their HP, A1C? Like, why are we honing in on like one particular thing, right? Maybe if you're Brian Johnson, that billionaire who like, is trying to figure out how to live forever, like these things could really matter. Nothing against him. N of one. He's doing something that works for his body. But I really think we need to just keep it simple because we're losing people when we don't. And I think that that's why, like, I'm just such a big proponent of like cook most of your meals at home. Use like good quality fats. Don't snack. Eat real foods. And most of your problems are going to go away.
Yeah, I agree. I think there's
And like, what is your goal? Do you want to live to 105? Sure, maybe you should look at these things. Or do you want to live like a long, healthy life and be strong? Just, listen to the simple advice. That's my take. I could be wrong, but that's my stance, and I'm pretty assertive about it.
yeah, I think that comports with my belief as well. I think these are fun topics to talk about. I think, and I think sometimes I talk about them from like a if you're having a discussion with somebody who is against eating meat, like I want to know this information because like I want to ultimately find the truth. I want people to live happy, healthy lives, with the best nutrition possible. I like having these conversations, but I think you're right. There's like a diminishing return at some point. It's like the old 80-20 rule. It's like you can focus all this energy on these little minutia, but yeah, forest for the trees. Like you're missing the important part here is like most people in America are unhealthy. They're obese. They're sedentary. They have all these issues, and it's like, man, like maybe we can have these conversations, or maybe they'll mean something when folks are down to 10% body fat, and they're worried about optimization at that point. They're moving towards the Ben Greenfield space. But for the average person, man, like I think keep it simple is really important. I was talking to Vinny Tortorich, and that's where he came up with the no sugar, no grains, NG, because it's just like I'm trying to keep it simple, like because you don't want to overcomplicate things because people will just they have a hard time sticking to something that's complicated.
Right. And I think like we even like lose people when we say things like mTOR, and it's like we just need to tell people what to eat, right? They need like a recipe, like where to shop.
Yeah.
Like people are busy. Like let's just like keep it as simple as possible. That's my stance on it. I think it can be exhausting listening to like these like very detailed discussions of like, well, if you eat too much, red meat or chicken or fish or whatever the protein is, like you're gonna have a shorter life. Okay, well, you're also gonna have a shorter life if you don't stop eating like just like the junk. Like, let's start there.
Yeah, yeah, I agree. And I think a lot of it is sometimes not even the person themselves. At least it isn't in my case, or wasn't. It's like people around you, right? Like when you start making this change, it's a very weird thing, man. It's like when you're eating the Doritos and all the bullshit, people are totally cool. But as soon as you like move, it's a meat heavy, whole food based diet, then suddenly they're very concerned about your health, and pretty, you're gonna clog your arteries, and you're gonna have a heart attack and a stroke and all the, like, they're very concerned at that point. So I think some people are just concerned about sort of pushing back against people in their lives that maybe mean well, uh, but are, rightly concerned because of some of the propaganda that they've been receiving over the years, right?
Yeah. And I think when you encounter that, because we're going to encounter that all the time, right? Like, I get that a lot too. Like, oh, like, do you really eat that much red meat? Like, do you eat it more than like once a month?
Yep.
And I'm like, you just like don't even say like it's healthy, or just say like it makes me feel good, because it doesn't make them feel bad about their diet. It's just like, oh, like, make it about you, not about them, so they don't feel bad about themselves, and then just get really good at the art of changing the subject. Ask them a question about themselves and then just move on to a different topic. Because if people are ready to ask you questions about your diet and actually learn something, or like say like, hey, like, how did you do this? That's different. But most people are just concerned because, they've been indoctrinated by, commercials, their own doctors. Everywhere we look, we're told to eat ultra processed food, so people believe that it's still healthy.
Mm. Yeah, that totally makes sense. I wanted to pivot slightly now that
Mm-hmm.
I'm starting to think about cardiovascular health. All right, because that seems like that is an area of focus. People that are against meat. So have you delved into this topic a lot? Sort of like atherosclerosis and cardiovascular disease and its origins. Like, do you have a hypothesis or a belief around like what causes that?
Yeah, I mean, I'm definitely not a researcher in this space, and I'm definitely not a cardiologist. But what I'm hearing is, atherosclerosis is, mostly from highly refined grains and a high sugar diet, which is the standard American diet, right? So I'm of the belief that, again, if you avoid the junk, you're going to avoid this. You're going to reduce your risk for cardiovascular disease. You're going to reduce your risk for stroke. So I can't be convinced otherwise. I know there's a lot of, ApoB is a really hot topic
Mm,
and all of that other stuff. But again, I think that if you eat real simple whole foods, you're going to be okay. And if you're not, it could be like maybe the way you ate for the 40 years before you did that, right? Like, I think you can improve, but sometimes it is too late, right? If you change your diet at 75, like,
you're
you
right.
can't erase what you did, the past 40 years, sadly.
Right, right. And I think my understanding, please correct me if I'm wrong, if you know
Hmm.
something different, but my understanding is that it's really endothelial dysfunction, right? So you have disrupted endothelium. For those who don't know what that is, it's a single-celled wall of tissue that is on the inside of all of your blood vessels, right? And that can be disrupted one of two ways, as far as I understand. One is uh, inflammation, right? So like you
Right.
said, like grains,
Chronic
sugars,
inflammation
chronic
from, yeah,
yep,
right.
and that can be typically measured with there's a what is the C reactive protein. You can have your C reactive protein tested in your blood work, but if that's very high, then the walls will be inflamed and it will crack, right? And then when those things crack, that's where the lipids start flowing in as like a little bit of a band-aid, but they get between the endothelium and the wall of your artery and build up a soft plaque that eventually calcifies and turns into a hard plaque, right? And then I think the other one is around blood pressure too, right? Having high blood pressure is a risk factor, to my understanding, because you're putting so much force in there that you're those cracks they form, and then you start pumping in all of that those lipids, right? So it makes the plaques
Mhm.
worse. And so those are the two aspects, at least to my lay understanding, that causes this type of heart disease. It's not eating red meat with or a high fat diet.
Right, that clogs your arteries.
Right.
Yeah.
Wasn't the old thing. I remember in the 80s they told us in health class that it was like pouring hot grease down a cold pipe, right? That's
Right.
really that was the amount of sophistication they had when
Totally.
they claimed that high fat diets were detrimental to your cardiovascular health.
Yeah, I mean, and that's still the case. Like, if you follow JT Carnivore, like he just did like a, I don't know, a video where he like commented on like a recent video on like TikTok or something where a dietitian was saying that like, meat clogs your arteries and all that kind of stuff. So I mean, it's like still out there, and she has like this huge account, so this messaging is still out there. Yeah, I mean, back to the chronic inflammation and hypertension. Again, if you feel like you have chronic inflammation, and that might look like you just feel puffy all the time, right? You might have like arrhythmia, like redness in your face. You might have like more of like a moon face, right? You might have a lot of visceral fat all over your body. You might have a lot of visceral fat, like, or abdominal obesity. That is your body's like warning sign, like, hey, there's a fire inside, and the alarms are going off. And then hypertension, that's also another signal. So again, if you want to address those two things, keep it simple. Get rid of the junk, or no sugar, no grains if you really need to go like, all in. And address those things, and you're going to reduce your risk for cardiovascular disease. You're going to reduce your risk for stroke, and you're going to reduce your risk for all these other things, dementia, type 2 diabetes, all of these like modern chronic diseases. So I know that I sound like a broken record, Brent, and maybe you do, but just keep it simple. Eat real whole foods, and most of the stuff goes away.
Got it. Got it. So, what do you think about fish oil? Like, it seems like there's some controversy lately about efficacy of fish oil and various types. Do you have an
Yeah.
opinion on that?
Yeah, I think that if it is sourced, if you have like a good source, like high quality fish oil, I do think it is worth taking. I think that we do have enough evidence to show that it will help with cognitive health down the line. So why not do it, right?
Yep.
If it's in your grocery budget to get like a high quality fish oil, like take it. Now, if you're eating high quality fish on a regular basis, you might not need it. But not everybody likes fish, one. Um, High quality fish can be expensive, so maybe it's more affordable to get like a fish oil. But that's my stance on it. How about you?
I don't know. Like, I'm sort of, I sort of align with that, I guess. But I've been hearing other stuff come out that's like, oh, maybe it's not so effective, and so it's one of those things that's in the maybe camp for me, but it also is in the camp of I don't think it hurts.
Exactly, right?
I have been focused on a higher quality fish oil. I used to just go to the grocery store and grab whatever's on the shelf. And then
Mm-hmm.
Rhonda Patrick, to her credit, linked out to a website that sort of lists. They have some testing of these fish oils for rancidity. Some it might be too wonky, but they can oxidize, right? And
Right.
and can actually cause inflammation, which is not what you want to do, right? So I looked at that data and said, like, okay, this is a high quality one, and it's fairly expensive. I think I got Omega Genetics or something like that.
Mm-hmm.
And so I got that. I put it in my fridge and made sure that it wasn't exposed to light and all the things. And it lasted me like 2 months, but it was like $90 a bottle, which is fairly
Yes.
expensive, right? So I see why people
Right.
might not want to invest in something that's high quality like that. Um,
Totally.
but also, like, I think finding decent fatty fish to eat isn't that hard either. It's not even that
Right.
expensive, right? So like I go to Costco. Thank
Mm-hmm.
God they just opened one down the street for me, because I used to have to drive all the way to West Nashville, which is like,
Mm-hmm.
40 minutes each way. But so
Okay.
now I can just go 15 minutes, pick it up, and it's like an entire fillet of like Alaskan salmon. It's wild caught salmon.
Mm-hmm.
And it's like $9 a pound. Like, this isn't super expensive.
It's a great deal. It's a great deal, and you can like cut it up, vacuum seal it, and
Yep.
you'll have fish for like a couple weeks. Yeah, it's a fantastic deal. Thank God for Costco. But yeah, I mean the fish oil supplements are really expensive, and like this economy, like you can't buy everything that you need.
Right.
So I think that if you are on a budget and you can't afford like a high quality fish oil, like go to Costco, get the wild salmon, have it once a week, have it twice a week, incorporate it into your diet is probably just as good. But I don't think we know enough. But it's something that I do spend money on, but I have to mention my family, so I'm a little bit
Ah.
more aware. I'm a little bit more aware of it. My grandmother died from it, but she also had type 2 diabetes, so I don't.
Mm.
But it is something that I'm mindful of.
Yeah, aren't they starting to call dementia like type 3 diabetes?
Yes, yes, Alzheimer's, type 3 diabetes. That's correct. So yeah.
Interesting. So completely going down another rabbit hole here, but are you sort of up on the literature around sauna use?
I mean, I wouldn't say I'm up on the literature, but like I feel like I follow people who are.
Fair.
And I would love to have a sauna to use, on a daily basis if possible. I mean, I think if you look at the populations that use it, they do have a lot of longevity, and I think that that's worth noting. Even if it doesn't add to longevity, like it makes you feel good, right? It's like a chance to like not look at your phone for, 20 minutes. Unwind, just like focus on yourself. So even if it's just for that, I think it could be good for your mental health.
Yeah, yeah, I completely agree. And it's funny, I'm actually working on putting a sauna out in our backyard this summer. That is
That's
something because
awesome.
I keep going to the YMCA, and that's just it's kind of gross, and I got to drive out there. Like I would love to just pop out there and hit the sauna and cold plunge before bed.
Yeah,
But for me, like even though I'm doing the YMCA now, like I've had a massive drop in my blood pressure. Like I was borderline
right.
high blood pressure in December, and I think now I'm like roughly 111 over 72 or something.
Right. Like the data on like how it's good for like your cardiovascular system is crazy. And I don't think most people even know that.
I don't think they do, and I don't think people think about the mechanistics involved here. Right? You talk about blood vessel biology again. Just people don't realize they think they're tubes, right? But ultimately
Hmm.
they're muscles, right? So there's muscle that surrounds all of those blood vessels, and when you get hot, those things dilate, they expand, and when you get cold, they constrict, right? And sort of that flexion of that tube actually helps maintain pliability. It stops it from hardening over time and increasing blood pressure. And so I think a lot of people, aren't aware kind of the mechanistics behind it.
Yeah, that's awesome. How long do you go in for, Brent, when you do
It
go?
depends. I do between 30 minutes and an hour, depending on the day. And it's
Nice.
weird. My heat tolerance definitely changes day over day. I don't know why that is. And it also might have to
Huh.
do with the temperature variance. I guess the YMCA, it feels like when I go in there, some days it's hotter than others. And this is like the downside of using a public sauna. Is like you don't really have much control over that. So I'm really
Right.
looking forward to getting my own, and so I can actually set it to the same temperature every day, and I'll get a little bit more data around that. But ultimately, I don't really care that much. Like I stay in as long as I can stay in, and it's done tremendous benefits for me. And I think there's
Nice.
also benefits with respect to dementia too. I think there's some uh, it can clear out amyloid plaques. There's some evidence around that, which are hypothesized to be implicated in dementia and Alzheimer's and that sort of thing. So I think all in all, that's one of those like really low hanging fruits that we can all do. It's like if you're especially if you go to a public
Right.
gym that has one, yeah, go do your workout and then just pop in for 20 minutes. I think the Finland studies, what do they have? Something like if you did 4 days a week or more for 20 minutes at a time, I think they had was it, like a 62% reduction of dying from any cause, all cause mortality. Like that's phenomenal.
It's crazy. And I think too, like when you go in, like we were speaking to earlier, like your mental health, like it's a chance to like do nothing else, right? No one's gonna call
Yep.
you. Hopefully you're not looking at your phone. And it's a chance to really like sit down and unwind. And that can help your blood pressure too, right? Like actually
Yeah.
giving yourself a moment in the day. So I think that there's like a lot of great benefits. I don't see a lot of risk. I mean, certain populations it wouldn't be great for, right? Like I don't know, like if you're pregnant, you probably shouldn't go in, from my understanding, but maybe I'm wrong. But
Yeah,
yeah,
yeah, and I don't know about any of those risk factors. I've never had to worry about being pregnant, so I didn't even look at that one.
right, right. Or I think fertility for men too, if like you're trying to conceive, I don't think
Oh,
sauna use is
yeah.
great for like testes. So I mean there are certain times in your life where maybe you would hit pause on it, but overall, I think it'd be a great investment, and you're making me really want one for the end of the year.
Hey, I feel like I'm like the world's best sauna salesman. Everybody I talk to, I'm like, yeah,
Yeah,
I'm getting one. You should get one. Like, hey, Plunge or somebody hit me up. I love an endorsement deal. No, just kidding. Um, want
right.
to talk to you about something else. I'm really not concerned with. I'm interested in. I want to get your take. Is how do you feel about collagen, like hydrolyzed collagen supplements?
Yeah, I've kind of gone back and forth on it. Like I think it's again one of those things like if it's in your budget, I don't think it's going to hurt you, right? I did see a difference in like hair, skin, and nails, so vanity things, when I did take it regularly. But honestly, right now, for me personally, like, just like the cost of groceries right now is astronomical. So it's just like something that doesn't make it in the grocery cart anymore. But, I do think that that whole N of one thing, like it worked for me. It's not going to hurt you, right? It's a little extra protein in your diet. So why the heck not? What are your thoughts on it?
Um, I don't know. I'm experimenting with it, right? So I
Mm-hmm.
have been taking it in my coffee, and I take a lot. Like I take 4 scoops a day. Um,
Nice.
and I'm just seeing because I've got a little bit of background. One of the reasons I was excited to talk to you, being a PT, is that I've got a bad knee injury that doesn't seem
Mm-hmm.
treatable right now. And I was just kind of hoping that maybe there would be some. I know it's articular cartilage; it doesn't really grow back, and I'm throwing a hail mary here, but I'm hoping there'll be something there because that's I used to be a distance runner. Like ran my last marathon in 2019, but I had that really bad articular cartilage issue, and I can't really run distance anymore. At least not at this weight. I keep hoping if I get down to my target weight, I can maybe
Yeah.
get by. But it just my knee swells up like a softball, and I got a
I
Baker
think give it
cyst and
time, though.
what's
Give it time for sure. I think that, you know, I don't know what your diet was like before January, but,
terrible.
yeah, I mean, think about all the years of chronic inflammation, right? So keep going. I would say strengthen, 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 stretch, walk. When you feel like you are like, okay, I'm at a weight where I think I could do this with my knees. And that might look like, I can walk 5 miles, maybe uphill, downhill, and then I feel fine the next day. Like my knee doesn't blow up. Then start run, walk, right? Like, so let's say you have 10 minutes, right? Run for a minute, walk for a few minutes until you can get to that like full 10 minutes. Also, some people just need a knee replacement at some
I
point, right?
know. I know.
But it can take a long time. So give your body like months, even over a year, to really reduce that knee pain and that swelling. And I do think like a diet that's very low in inflammatory foods is going to help out tremendously. And then we also know like the number one thing you can do, and like all orthopedic surgeons say this, all therapists say that, is lose weight, right?
Hmm.
The less force you have on your knee coupled with like a proper human diet is your best bet for feeling your best. Now, that being said, you might not be able to run, and that's okay, right? You
Mm.
might just have to but test it out, give your body some time, strengthen, work on your flexibility, work on your diet, and you might be surprised at what you can do after that. My boyfriend experienced that. Had like he was a D1 college soccer player, and played beyond that, and I don't want to say like did a lot of damage to his knees, but he used them for many decades, and it took a good couple years for his knee to finally calm down. He's like finally at a point 3 years later where his knee doesn't blow up when he tries to run, but it did 3 years ago. That is for sure. And that was really frustrating for someone who loves to run. I don't love to run, so I can't relate. But the point of me telling you this is give it some time. It is possible.
Yeah, I'm holding out hope because I really do love running. That's how I stayed in shape, and that's one of the reasons I got so
Mm-hmm.
out of shape. Is like my primary, method of staying in shape was just taken from me, and I just didn't have anything to replace it with.
Yeah.
And so I also keep hoping that there's going to be some new technology that's going to come out, and that's why I've been sort of slow walking this because my surgeon's like, yeah, I mean, basically you have a flap on the back of your kneecap and one on your femur head, and they're clicking on each other, and like if I remove it, then it's bone on bone, which is worse. And so, hey, sorry, not much we can do besides a replacement. And I always felt like replacement is pretty extreme. I'm always like, hey, you can only do that once, right? So I'm kind of
Yeah,
being
you could do it twice.
oh,
I definitely have people who have like a revision, they got it when they were younger, like maybe in their 50s, and then, I see them when they're 70, 80, and it can be done. I'm not a huge proponent of surgery if it's unnecessary, but it's a fantastic surgery. It really is.
got
It,
it,
it
got it.
does give people a new lease on life. So,
What I meant was that's a one-way door, meaning you can't go back through it again, right? Like
yeah,
once you've cut, like you are, then you're in that cycle of, and I think you have to replace them every 10 years or so.
they're lasting a lot longer these days, and it's very patient specific. So, some people get, a couple decades out of them. So,
Hmm.
Anyway, I think keep and strengthen, or in the meantime, find something else for your cardio that you enjoy. And sometimes that can even just look like strengthening, right? And like brisk walking. But give it some time.
Cool. Well, I appreciate that. That gives me some hope because I've been pretty down about it. And it's like strengthening is even hard too, right? Because there's not much I can do. I can't do squats anymore. I can't do extensions anymore. They said don't even do like leg curls. So most of the things that I typically would do to strengthen it are not available to me.
Yeah, and I think you could do leg curls. I think, be your own end of one. Like, see what works for your body right now. And if you can't do like heavy leg curls, like start where you're at. Start where like Brent is at.
Hmm.
I don't think that there are exercises that are off the table. I think that that is bad advice. I think you have to listen to your body, just like we were, talking about with food, right? There's not one right way. So start where you're at. Don't be afraid of strengthening. And then in terms of losing weight, like muscle tissue takes a lot of calories to maintain.
Yep.
So the stronger you are, the better your metabolism, and you lose weight and you feel good. So keep going.
Awesome. That's great advice. Thanks for that.
Yeah.
So,
Sorry, just one more
hmm?
thing. Do you follow Howard? I think it's Lux, Luks. He is a orthopedic surgeon, and he has a great account on Twitter or X. And I love him because his approach is a little bit different than most surgeons. Like, obviously, he's a big proponent of these surgeries, but he's really about like controlling inflammation and strengthening and working through the pain, and you'll eventually get better.
All
Or
right,
many
great.
people.
I will.
Mhm.
I definitely was not, but I will follow now.
Yeah, he's
That's
great.
good. Cool. I wanted to finish up with something that I like to ask people, especially people that are really thoughtful and pay attention to these things. Is what have you changed your mind about recently?
Hmm. Yeah, I have. That's a great question. So I'm a little late to the game, the sourdough game.
Sourdough game. Tell me
Yeah,
more.
I don't do well with gluten. I know that about my body.
Hmm?
Um, I just, I get a stomachache the next day, and that's just like not how I want to live my life. But, I heard all these things about how, your body can handle a little bit better, and it does. I learned how to make it. I make a loaf once a week. The kids in the family, they eat most of it, but it's great to have like half a piece of toast once in a while with eggs, or have some with like a little bit of olive oil when you're eating some fish. And I'm doing okay with like the carbohydrates with it. So I committed to this year, if I'm going to have anything like that, it's going to be made in my kitchen.
Mm,
So kind of changed my mind about just like adding in a little bit more carbs, like bread carbs that I personally make, and my body's responding really well to it. I don't get a stomach ache, and it just feels good. And I'm sure I would get a lot of hate
I was gonna
about
say,
this.
like I'm seeing the people firing up their torches and grabbing their
I
pitchforks.
know.
We're gonna burn Lindy at the stake here.
Yeah, but like I know myself, like I know some people can't do that, just like an alcoholic can't have one drink. I know some people just can't go down that route
Hmm.
with things like bread, but I can. And it's part of like my 80/20 thing, but if I'm going to eat it, I want to make I want to buy the ingredients for it, and I want to make it in my kitchen. So that's kind of what I've changed, like a little bit more carbs, even bread, but I make it here at
Got it.
home with my own hands.
So what about the sourdough? Is it specific to sourdough, or is it just like I like sourdough?
Yeah. Yeah, so because it's fermented, it, allegedly, and I've experienced this as yes, it works. Your body can break it down a little bit better because of
Hmm.
the fermented, because it's fermented. So, it's been fun. I mean, it tastes fantastic. It makes the house smell great. Uh, I don't have kids, but like my partner has kids, and they love it, you know. So it makes them happy, and then teaches them, make real food at home, even if it takes a little extra time, like a sourdough.
Got it. Got it. And so, do you go so far as to get like the heirloom wheat, or you just get like the regular flour and say, "Hey, this is good enough"?
Yeah, you know what? Do you follow Carrie Kelly?
Yeah, I love Carrie.
Yeah. So I don't know what he made a couple months ago, but I started to buy this flour. He buys it. It's on Amazon, but it's like from Italy. So
Ah,
it's a little
yep.
bit more expensive, but it's working.
Uh,
So it's not flour that's from here. I haven't tried flour from here. I don't know how that would be. I'm not against it. But yeah, but just using like a special flour.
yeah, yeah, great. I've heard that before. Like I've never actually gone down that road, but I think my brother and sister in law they swear by it. They've got certain gluten intolerances or wheat allergies or something going on, and they get this stuff from Italy, and they say haven't had any trouble. So I was always curious if people, um, if they're having that similar experience or if it's something different.
Yeah, I mean, if it's something that you want to explore with, like a green light, give it a try. But everybody's different. No shade if you don't want to eat that.
Cool, cool. Well, hey, we're coming up on time. So what I wanted to do is just give you an opportunity to let people know where they can find you.
Yeah, sure. I have an account on X. That's where I'm very active, or Twitter. It's Dr. Lindy Louise. And then I also have a YouTube channel. So I interview people like you, Brent, and, healthcare providers, or people in the health and wellness space from all over the world. And we, hyper focus on eating real, simple whole foods. And then more importantly, I am a passionate home cook. So on that YouTube channel, I cook and share how to make simple things at home, because I think that's where your health starts, in your own kitchen. So follow along if you need just recipe ideas. And it's been an honor to be here, Brent.
Yep, thank you, thank you. By the way, I've totally stolen recipes from you, so everyone go check it
Yeah,
out. It's awesome.
we got to share with that. It's a big question. What's for dinner? We all need help with it.
Exactly. Well, hey, thank you so much for joining me. It was a great conversation. I really appreciate it, and I really hope to have you back again.
I would love that. Thanks so much, Brent. Have a great
You
day.
too. Thank you.